I'd like to demonstrate the Eyecon's validation mode, where we can make sure we're getting the right quantity of the right drug to the right patient. So from the main menu, select the validation menu and press continue. The Eyecon prompts you to scan your vial label. So you simply scan the barcode that was added by your pharmacy system that contains the RX number, the NDC, and the quantity. So now the Eyecon knows what drug we're supposed to dispense and what quantity. Now I grab my stock bottle, scan that stock bottle, and the Eyecon's now in the counting mode, ready to count pills. So it's looking for a quantity of 30 of aspirin, low dosage, 81 milligram. There's the NDC number that we're dispensing. That's the exact same NDC as what was prescribed in the barcode that we scanned. So the quantity displayed here is what we've got on the tray right now, and there's the quantity that we're looking for. So we simply pour pills on the tray, let the Eyecon do the counting. We've got 42 pills, scrape off some excess. We're down to 33. I scrape off the last 3, we get to the right quantity. Put the excess back in the stock bottle, press finish, record the transaction, put those pills in the patient vial, lift the tray by the back. Done. That quick. Dispense the right quantity, the right drug to the right patient. Now I'll show you a few variations on that process. This time, I'm going to scan a barcode that's the same drug, but in a different size stock bottle. The Eyecon gives you a warning indicating the last 2 digits of the NDC number are not the same as what was adjudicated and sent over in the barcode. So if I want to prove that, I can hit yes and allow me to go ahead and fill that prescription. If I press no, it brings me back and says, okay, well, scan the right stock bottle then. This time, I'm going to scan a completely wrong NDC, and it gives me a different warning. It says non-matching NDC and GPI. In other words, it's not the right drug, it's not even a generic equivalent. It just allows you to press OK, and again, waits for you to scan the correct stock bottle. This time, I'm going to scan a generic equivalent. So we scan this barcode. It says GPI substitution. It's not what was adjudicated, but it is a generic equivalent. Do you want to use it? If I hit yes, it says, okay, I'm ready to start counting. So now it shows what NDC number we are dispensing versus which one was sent over in the barcode. The name and picture of that drug are shown here as well. So now if I go ahead and pour those pills on the tray, pour the excess, scrape off the excess, put it back in the stock bottle, press finish. But before I do that one, let me show you. I'm sure you all run into a situation where you're short on a particular drug and you need to short fill a prescription. So if we go ahead and say we're only going to dispense 8 of these pills this time, so I press finish, the Eyecon gives me a warning. It says, are you sure you want to short fill that prescription? So if you're not paying attention, you've been dispensing 30s for several in a row, and all of a sudden you've got a 60, and you go and count out 30. You counted them right, but it wasn't the right quantity. The Eyecon will give you that warning, so it gives you the heads up. This time I'm going to say yes. I do want to dispense that short because I'm running low and I want to save some for Mrs. Jones, who's coming in later today for that same prescription. So I put my excess back in the stock bottle, dispense those into the patient vial, and it's ready for the next prescription. I come back to the Eyecon a couple hours later, a couple days later, several months later, doesn't matter, up to that purge time setting, up to 180 days. I scan the stock bottle. I go ahead and scan my stock bottle, and it gives me a warning. It says, okay, the partial fill was detected on the most recent fill of that prescription number. It was written for 30 drugs. 30 were dispensed, and it tells you the exact time and date that those 8 were dispensed for that 30 count prescription. And the remainder is 22. Which one do you want to dispense, the 22 or the full 30? So if I hit remainder, it's going to only require me to dispense 22. So the Eyecon is keeping track of every short fill or partial fill, IOUs as some of you call them, prescriptions. So we're tracking that for you. You don't have to keep those on a little sheet of paper in your pharmacy anymore. So now I go ahead and pour my pills in the tray. Again, over pour a little bit, scrape off the excess, let the Eyecon do the counting, scrape off the last 3, and press finish, record that transaction. Put my excess back and dispense those into the vial. Next, I want to show you how you can use the Eyecon's validation mode with user login. So I've gone ahead and enabled the login feature, and I press continue. Now the first prompt that comes up is scan user login. I've added a barcode onto my badge attached to a tether, so I've got it with me all the time. So this barcode has my user ID. So I simply scan that. Now the Eyecon knows that Dave's about to fill this prescription. So I go ahead and now it's telling me to scan the vial label. Works the same. I scan that barcode telling it the RX NDC and quantity, scan my stock bottle, and now I'm ready to fill prescriptions. Pour my pills on the tray. Again, when I go over, it turns red to let me know I'm over. Here's another interesting aspect of the Eyecon. If you have an object on the pill tray that's not the right size and shape, the Eyecon goes into the error screen and shows you where the object is that doesn't look right. So I happen to have a broken pill on the tray, and it's pointing out right where it's at. So I go over here and remove that off the tray. Now I'm back to counting, and I'm showing you exact quantities again. So now that I've gotten rid of my broken pill, and scrape off the excess, get back to the right quantity, put the excess back in the stock bottle, press the finish button, record that transaction. I do want to point out that the Eyecon is more forgiving. The goal of the Eyecon is to count pills fast and accurate. So if the pill that's on there is close to the right size and shape, it will still count it and won't give you a warning. But if it's different enough, it will give you that extra detection of the wrong pill on the tray. So as you can see, the Eyecon is extremely useful in ensuring you get the right quantity of the right drug for the right patient, and also keeping track of those partial fills for you.